This video is an absolute gem of a lady who is an amazing person, a beautiful lady from Canada who tells her story of recovering from not just persistent pain, for which she's still moving through to some degree, but how she's recovered from more linked persistent conditions that are outside the field that I normally deal with, but things like IBS, interstitial cystitis, acid reflux, and these follow this very similar pattern to persistent pains, persistent conditions. And this lady tells her journey of recovery from those and how she's continuing to recover. It's an inspirational story. It's quite candid. She's a very honest, authentic lady, and it's a great listen. If you can set aside a little time for yourself to listen to Colleen, you'll pick up some absolute gems. Thanks for
Okay.
thanks for connecting, Colleen. I know that I'm interested in persistent pain, and I'm really interested in people who've had an experience of it where they've managed to see improvements through ways that might be interesting to other people who haven't seen that improvement. And you popped up as somebody who'd kind of expressed an interest in sharing how you
Mhm.
done or how you were doing. So tell us a little bit about you.
Okay. My name is Colleen Ensko. I am 49. Um, I live in Medicine Hat, Alberta, Canada. And yeah, I don't know what else. I'm a very I call myself an athlete because I've been a bowler for 38 years now, so I compete competitively for that. So that's part of my life as well. Bowling's been a big part of my life, and I'm also a worker at our hospital here. I clean the hospital here in Medicine Hat. Yeah, I have a husband. I have no kids though. I have no kids. I just have nieces and nephews. Yeah, so that's who I am, but other than the pain stuff, but
Well, thank you for sharing that with us. And
Mhm.
what pain did you experience, and how did it interrupt that at those
uh
aspects of your life?
yeah. Yeah, I don't it's such I'm trying to get it into jam it into a little space here because there's a lot. But I guess, I've always had lots of chronic conditions growing up. I just didn't realize. I sound like a lot of other people. But I didn't realize at the time. So when I was 14, I had lots of IBS issues. So I had like constipation really bad. Like I remember, yeah, vividly not being able to walk, because of constipation issues. So that went on for probably 20 years, a long time. I had a lot of issues with that. And then I developed like acid reflux really bad for over 10 years. Yeah, I was on medication for that as well, for probably 7 years. Just like, yeah, just acid, just a lot of gastro issues, gastritis. I can go on, lots of stuff like that. And then about 10 years ago, I was diagnosed with painful bladder syndrome, which is like IC, as well. So I lived with that for about 10 years. And the doctor told me I actually got a cystoscopy done on it. And he told me I had like Hunner's ulcers and my bladder was inflamed, and that I would never get better. That's basically what he said. He said it's something you're going to have to live with the rest of your life. um, so I took a lot of Advil and ibuprofen for many, many years, every night, probably close to every night, for the pain because it was really bad at nighttime. So yeah, so they lived with that for a while. And then about 3 years ago, I was having some hip back pain. And it started out, when I was bowling, I could feel like a twinge a little bit. Like it wasn't nothing too serious. It was just, it was kind of there, right? And I just continued to bowl and work and do stuff and all my other stuff. So I I decided, or it just got worse, right? So I would work out in my gym. We have a gym in our garage. So I'd kind of do some workout, and it was starting to get worse and worse. And then it got to the point where I was working. Obviously, when you're a cleaner, you do all the twisting, the bending. You can just, right? That's what your job entails. And it just got worse and worse. And one day I was at work and I couldn't do it no more. I was crying. I know, I don't know if I should say this on video. Maybe we can edit it out after. But it got to the point when I would go to the bathroom, I couldn't wipe, right? I couldn't bring my hand around to wipe. Like it just, my hip would lock up and I just couldn't do it. Like it was impossible, right? I just couldn't do it. And that was scary, very fearful of that. And of course I broke down and I'm like, I can't even like wipe myself. Like I can't I can't get dressed, you know? So it was really hard. And I get emotional, I'm sorry. So that was my last day of work, which was about 3 years ago. And and it just went, I had trouble like getting up in the morning. Like I'd have spasms where I couldn't move. My husband had to help me off the toilet. So it was really bad. Obviously I couldn't bowl, as you can imagine, either, because you bend, you do all that stuff with bowling. It's and I should mention my weight is 15 pounds. So it's not a light weight. So anyway, I went to the doctor like most people with back pain and all hip pain, to see him about it. And they did an x-ray and a CAT scan on me. Went back to see him, and he's like, oh, well, you got some hip arthritis, right? In both hips. I'm like, okay, you got some calcium deposits, whatever. And then he's like, well, that's interesting. I'm like, what? He goes, well, it looks like on your right. Now, I should mention that most of my pain was on my left, okay? Like everything was on my left side, like my left hip, my left, like sciatica going down my leg, all that. So most of the pain was all on my left. I should mention that. I didn't have too much on the right at the time. And so he's like, oh, well, it looks like you got like herniation and disc bulges in your back on your right side, right? And of course, not knowing any of this mind body stuff, of course, I did find it odd though, because I did ask him, I'm like, my right. I told him, I said, well, that's strange. I said, I don't have pain on my right. I said, my pain's on my left. Like I can't move on my left side. And he's like, he actually didn't know what to say. Right? Because what do you say? Because he doesn't know. And then people are telling me, oh, maybe he's like, well, maybe it's like it crossed over, right? Maybe, type of a deal. And I left that day and I said to my husband, it's so confusing. I'm like, why do I have, anyway, it's just funny. So a month later, you're probably going to believe this. But guess where the pain went to? It went all on my right side, right? So that was, anyway, looking back, that's a huge evidence moment. It's so huge, looking back. I tell that to so many people, and they laugh at that because I'm like, it's evidence right there. If you don't believe what I say, that's evidence. So physio, obviously, prescribed physio. He said we can do injections as well. So I basically did everything, right? For 9 months, that's what I did. I did physio. I had 6 injections. I had them in my hip. I had them in my, my SS or my, the lumbar down there. So I had 6 of them. They did absolutely nothing. I was quite, so that was depressing actually, because you're hoping that pain will come, or that it will go away, I should say. So that was hard on me. And this whole time, I couldn't bowl. So that's hard. That was my life. I went to tournaments as growing up and not being able to see my friends. And not being able to work because I love my job. I probably got a little depressed. So I did all this physio. it didn't really do much, right? It really didn't. I saw a kinesiologist as well, and I got really upset with them because they just kept telling me to do more bending and more bending and more bending, and I'm like, yeah. At the time, I was like, why am I just doing more? Like, why are you stressing out my my back, right? Like, there's more than just my back, right? Like, there's got to be, there's my, anyways, a lot of physio. I did do some carb, anyways. I did a lot of stuff that everybody else I've heard stories about does. I didn't do much, but I'm a very the type of person I am. Of course, I'm a perfectionist as well, so I have all the tendencies. I'm a very caring person. I have a very highly sensitive person, like an empath person, so I care a lot what people, yeah, like, right, like Goodism, all that stuff. So, but I don't give up. So I'm the type of person that is like, okay, this can't be my life, right? This chronic stuff cannot be my life. Like, there's got to be something out there. So of course I Googled and went on YouTube, and at first, believe it or not, I came across this this exercise, kind of strength exercise mobility workout. It's called Upright Health, and it was a 30-week program that I paid for. And he just talked about how moving the body, like getting the muscles moving, and not just the back, like just that it's all in your muscles. Like, you need, it's not your herniations. He even talks about some of that. He goes, but you can move your body. So I did, or sorry, it's a 15-week course. And it's like really good mobility classes, right? I did it like probably, I did 3 of them every day. Like, I did it morning, I did it in the evening. Like, I was very, like, every day. I did these exercises and these mobilities to get my body moving, because I wasn't moving much, obviously. So I actually did it for 30 weeks. I'd get up in the morning, I'd do my exercises. Like, I was very, hard on doing it. Now, you know what? It did help. After 1 month of just doing those mobility, I was able to lift a grocery bag. Like, things started to kind of look up. I was like, oh, like, I can actually lift something, I can move, I can touch my toes, like, so these mobility classes really did help. And of course, now when I learned of mind body, I realized why it helped, because it was like safety to the brain. Well, she's moving, she's doing all this stuff, right? We must be able to move. So I do understand it now, looking back, but that did help me one. So I wanted to mention that, because it really was a really good thing, because it moved your whole body. But then after the 30 weeks, I said to my husband, something's like, there's still, like, I still can't go back to work, right? I still have trouble bending. Like, it's funny, right? I felt like I was stuck. Like, do you know what I mean? I could only go so far, but I still couldn't bowl, and I still couldn't go back to work. So I'm like, and my husband's like, maybe I'll talk to the doctor again, and we'll set you up with a pain clinic, all this stuff. So, but no word of a lie, a few days before my was gonna go see the pain specialist here, I came across a video. I don't know if you've heard of Dan Big Big. He puts a bunch of videos out each day. I came across, because I went back to the YouTube, and I'm like, okay. So I came across this video, and it was one of his first ones. I think God was watching me when he saw this video, because I came across his first video that he had done for some reason. And he mentioned a Dr. Sarno and a book, right? Healing Back Pain. And anyway, so I was listening to the video, and I was like, oh, like, that's interesting, right? I was seeing a lot of stuff in me. So I was like, and I couldn't wait to get the book. I was like, I ordered it immediately, like, no word of a lie, like not even an hour. I ordered it immediately. I couldn't wait for the book. to get here, right? I couldn't wait. So the book came here and I read it like, I think like I'm a pretty fast reader, but I read it pretty quick. And I tell you what, my life changed. I'm gonna cry. Sorry.
Okay.
After I read it, I'm sorry if you want to catch in. I'm talking all this talking. And so anyways, I saw myself in all of it. And yeah, like I saw the goodism in the perfect personality that I am. And you start to understand, right? That, you know what, maybe I'm not broken. You know what I mean? Like, yeah, right. I'm sure you've heard all this, but not broken. So I was supposed to see the pain person in 2 days after I read that book. And the pain people phoned me in 2 days and said, and they didn't even want to talk to me. They just phoned me to set up more injections, like not even to talk to me, right? I'm like, this is crazy. I said, you know what? I said to my husband, I don't need it. I don't need it. I said, I've read this, you know, I'm reading this book and it's all clear, right? This is what's, yeah, I believed it, right? I totally believed it. And yeah, within, I think it was not even a week, I said, you know, maybe I can just go to the bowling alley and not with a bowling ball, but just do the motion, right? Just slide my leg over, like bend my leg, you know what I mean? Just do the motion. So I did, right? I did. I haven't done that. I hadn't done it in 2 years. I was on disability from work for 2 years and hadn't done it because I was scared, right? To do some stuff. But no, I did it, right? I'm like, oh, look, I can do this. So anyways, yeah. And I did some emotional work as well. During the book, he says to do some journaling, you know, you write down some stuff. Oh yeah. So that was another, yeah, lots of crying. I wrote a bunch of stuff that happened in my childhood as well that I didn't realize that was causing a lot of stuff. And then in 2017, I did have a heart attack in 2017 as well. So, so there's been, you know, some trauma and some issues, and like lots of people have issues. But anyways, yeah, so that's where it all started. was reading Dr. Sarno's. I read all of his books. I came across I actually read some of your book as well, The Pain Habit as well, and your videos, and then other people's videos. And that's how I became with Mind Body. And I learned, I guess, through all these different books and all these different, I think I just picked up little things from everybody, right? Different tools to help. And but I'll let you come in now that I've been doing this talking.
Well, it's lovely to listen to your story, Colleen, and you might think, oh, you've heard it before, and I say it like other people, but it's really important for you to understand your own story, and being able to express it from like you have there could just be the catalyst that somebody else could watch, and you might be able to help someone else
Yeah,
far more than any clinician.
yeah, yeah, yeah. No, for sure. For sure.
Really powerful story. And if somebody watched whatever you just said there, all the beauty of it and all the detail, then they'll cry with you and they'll laugh with you
Yeah, yeah.
because they'll see it reflected in themselves. And we're all individual, but the things that can happen and emotions that we feel that we can sometimes get stuck with, and we get a face on that can hide it. And
Yeah.
almost those emotional charges become embodied, and it's not some sort of hippie thing that's you know, you need to go to a mountaintop. You simply need to go through the process of metabolizing it so that you can start to use the body in the way that it's meant to be used, rather than it being stuck as a vessel that's repeating loops and patterns that consciously is very unpleasant for that individual.
Yeah, no, for sure. For sure. No, very true. Very
What
true.
about where are you now? Then where are you now in how you're feeling and what you're doing?
Okay. So with I'm feeling better. I did want to mention you know, with the bowling, 'cause like I said, bowling was a big part of my life. So I slowly did gradually go back to bowling. So like I said, I started just doing the motions. Then I added like a 10-pound weight, so something low. So I slowly just, you know, I'd go there, you know, twice a week and just slowly get the things going. And the more I did that, then the better it felt, because I was like, oh, you know, like I can do this. Now I did a bunch of, like I said, I did emotional work, right? I talked to my brain. I know it's one of the things that Sarno did, and it's one of the tools that I still use today. Um, just to kind of, you know, like, we're okay, we're just bowling, you know what I mean? Talking, I know people think it's funny, but it really does work. And just saying we're bowling, because it did, the symptoms did come up. Obviously, when I was bowling, I get very stiff, like, ugh, like it wants to lock up. So I'd have to like, no, we're just bowling, we can do this. So I slowly just worked my way back up in weight. Over a year or so, I worked my way back. I even went to tournaments. I went to my first tournament about last year, and I only used a 13-pound ball, but I did really well. I actually won. So I did really well. Like, I felt really good. My body felt really good. Bowling. So there's achievements, you know, and now I'm up to 14 pounds, which is a huge success for me. And I still go to tournaments now. I just came back from one a couple of weeks ago, where I bowled 12 games in one day. That's a lot of games. And so I was quite proud of myself. My husband had to keep reminding me, because I'm very hard. I'm very hard on myself. So my husband reminds me of that. Like, he goes, "You're bowling, Colleen. Like, be happy that you're bowling." So I just wanted to mention to viewers too that, you know, that how achievement can come, you know, from it. I got back to work in February of this year. I went back to work. So that was really a really good thing as well. And that was a little harder, I am gonna say, because I'm pretty sure that work was the cause, like the stress, like, because I put a lot of pressure on myself at work. I like to make sure that I clean the rooms properly for the patients. I care. And because of that, I do put a lot of pressure on myself at work. So I think that's where it all started, was at work. So it was hard to go back. I still had lots of symptoms, I'm gonna say, hard bending over, you know, and it would creep up a lot. So I had to do a lot of emotional, a lot of work every day at work to do that. So, you know, it's still a journey today. I wanted to tell this story because having to do with acid reflux, I kind of fast forwarded, but I wanted to mention that, you know, as soon as I read Dr. Sarno's books, and this, no, you know, I think it was only like a month after reading Dr. Sarno's books, my acid reflux went away, like completely went away. Right? It was crazy. It was crazy. I didn't have to take a bunch of, you know, diet, you know, a bunch of, you know, what you take for acid reflux, all the over the counter every day, every night, taking stuff, ginger tablets, all this stuff. It's crazy. It just went away. And then my IBS, like constipation stuff, you know, that went away. And then my irritable, but my chronic bladder, painful bladder stuff, that went away. Like, it was absolutely crazy. You go from every night, and I didn't even, like, that stuff just went away. It just went away, right? I just started to believe that, okay, maybe my bladder's fine, right? Like, there's nothing wrong with my bladder, right? Like, it's just stress, right? It's just tension that's causing all this acid reflux, causing all this stuff. So that actually all went away. So I wanted to mention that to people, because that's quite amazing to me. Now the back stuff, it's taking longer to do. Like, I've been doing this mind body work now for a year, and I'm not gonna say that I'm recovered fully. Well, I do. You know what? I should redo that, Sam, because I don't have fear. anymore. And I guess that's a huge success. Because I think, like you said, lots of people have fear, when it comes to their symptoms. And for me, I don't have fear anymore. So I may have symptoms, my back gets really stiff sometimes, but I guess the way I look at it as they're just emotions, right? All these things that I feel, because it moves around too. I get headaches, my wrist hurts. I can just go on and on about all these body things that you get. So I just think of them as emotions now, in this journey that I've had. So I still have, some mornings at work when I have to bend down to grab stuff that I can feel it, but but I don't care, right? I basically don't care. I just bend. I'm like, we can bend. That's what I say to myself. We can bend. So I bend. And then the more I bend, then the better it gets, right? You know what I mean? Same as, yeah. So I still am on this journey. And I know I've talked to you. I think I've commented on my morning, because my mornings are hard still. It's like a habit, like you said, for sure. It's one of those, I forget what you call it.
Like a conditioned response.
Yes. No, for sure. Every morning I wake up and I'm pretty stiff, getting out of bed. Some mornings it's not terrible. Other mornings it's, a little worse. So it's like when I go to the bathroom in the morning, it's like, it's hard to wipe at times, like what happened 3 years ago, right? But it's funny, but you're so right about the habit, because I said to my husband, yeah, but once I get up, like the very first time I go to the bathroom, sometimes I can't wipe, right? But when I walk downstairs, like half hour later, I have no problem wiping, like zero, right? It's like, okay, I've gone downstairs. It's like my day started, right? So it's just at that time, right? So I'm still having a little bit of, I still do get stiff in the morning, and I'm trying not to. There's my trying perfectionism in there that wants to fix it, and say, how can I get rid of this conditioned response? And this is when I did some of your tips. I try to lay there before I get up to do some breathing. Right? Just lay there, listen to some nice music, just do some breathing before I get up. So it actually does help. It's not totally, the stiffness isn't like I wake up and I feel great. It's not there, but it's less, right? I can move, I can get up, I can wipe. I know that sounds funny, but I can get up in the morning and do that. So there's some good there too. But yeah, so I'm still on this journey. And that's why I was worried about talking to you, about recovery, because I feel like I've recovered because of I'm not in fear anymore. So maybe I've already healed. I'm trying to tell myself that I've already healed because I don't have fear around anything, right? I can, yeah.
Yeah,
right?
what you're describing is it's over. It's over. And all that happens with that then is now you can recover without repeating the loops quite as unconsciously as you might have done before. We've all developed unconscious patterns that are good in life, but some of them are not so good. And if they've been a contributor to the pain, and in some situations they are the pain, long after the event stopped, even though we don't realize it, because we're in a coping strategy essentially, then once you see it, you can't unsee it. Can't unsee it. Now, it means if I catch myself biting my nails, but I recognise I started to bite my nails at a time in life in childhood that was upsetting, that event's over. But I might have done it so much at the time that when there's no stress, just to feel normal, I have to bite my nails. I don't know. I can control that. I do that. Can control that. But that's where the story started at a certain point, that the body automatically uses something that is soothing, but it's only ever short term, and the sustained use of it, as you know, then becomes a driver. So when you have the awareness now that I see, so there might be tummy situation or chest or toilet urgency or frequency or pain, then they're like Christmas tree lights only dependent on the surge going through the system. So if there's a surge, all of the lights might flicker. But if you control the surge and simply notice the lights without reacting to them,
very true.
Oh, there's this. Oh, here's that. That's okay. You've appeared. I'm in this situation. I know why that's here. Oh, that seems to come when there. So it's the indifference. It means as you recognize the symptom, it doesn't create a further surge through your reaction to it. Very true.
Very true. That's right on. No, that's exactly it. With all the tools that I have, I have the pain, but I can make it like, dissipate pretty quick, right? Just because I know what it is, like you said, right? You know what, you're aware of it, and that's it, right? Just being aware of everything, and it makes a big difference learning about this mind body, and thank God, I saved my life, right? It saved me from going down a bad thing, and stuff like that. So it's hard to explain it to, I have a lot of problems explaining it to work though. Do you know what I mean? Because people come up to you and they're always like, how are you feeling? What was your problem? Do you know what I mean? So I have a lot of issues sometimes at work, explaining, because people don't get it. People don't understand. They think, so you know what I mean?
Yeah, it's culturally, and in your culture and my culture, it's very uncommon to be able to see pain through this perspective. Very uncommon. And that doesn't mean we're any better or worse than anybody looking at pain this way.
Exactly,
But it gives you real empowerment over your own feelings when you can see it. It doesn't mean you don't feel emotion or pain, but you can unpick it by having some flexibility in how you respond, rather than just believing the cultural default of pain equals damage.
Yes, very true.
So forcing that view on anyone, it's like changing someone's religion. It's not going to happen in a conversation in the elevator.
It sure is.
It's not happening. They've been trained, we've been trained pretty much by our caregivers and parents, then society at large, then culture at large. And if you repeat the story of those beliefs to yourself while you're laid in bed with a pain, it takes some convincing for somebody else to tell you it's any different.
No,
and
you're
that gets
right.
embodied. It becomes embodied, essentially. So you don't even have to have it in your mind anymore. Tell yourself you've got a bad back for 3 months, and tell yourself every night, and feel frustrated with it. You pretty much wire it in.
Oh, for sure. That for sure. And that's what changed for me, right? Was people, and that's what because I just don't have the fear, right? The fear just went away. That's the biggest thing that got me able to bowl, right? Because I still have symptoms when I bowl sometimes, right? It's not like feeling great, but I know that I'm okay, right? I know that I'm just either putting pressure, and you know what? It's you've mentioned this before to other people too. I'm actually grateful for the pain, right? Because without this journey and me knowing, I had to cry again. Then you don't know how to deal with your my personality. I know I don't have to change my personality, but my work. And so when I start to get like chest pain, or I get back pain, like at work, right? I just know it's because I need to slow down. Like, it's like my brain saying, okay, like, we're stressing out here, right? You're putting too much pressure on yourself to get done. Just take your time. Don't rush. It's telling me to do that. So that's what I do, right? That's what I do. I'm like, nope, okay, we're rushing. I'm going to slow down. I'm going to take my time. So I do all these, to calm me down, and to just take some breaths and say, bro, you know what I mean? It's a big thing.
When you do that, and you listen to those earlier signals, the pain doesn't have to do it for you then. As you do it habitually, even in the
Mm.
moments where we might feel compelled to do for others, and you're compelled to do a good job, and you have the voice in your head to say you must keep going, then you're just offering yourself a little bit of compassion, but you're doing it with symbolic movements or breathing patterns or a word. And they might not
Yeah.
be words you've heard a lot of in the past, and they seem a bit strange when you mention them to yourself, but they're very, very powerful, aren't they?
They sure are. They sure are, right? So yeah, it's a blessing. It's a blessing that I was able to find, like, even like I said, your book was really good, and like all the videos that I've come across in Mind Body, everybody, right? It's just yeah, it's a blessing for sure. It's I wouldn't be where I am. I wouldn't be bowling for sure. I wouldn't be bowling or working, right? Or working. So I've had to do like compassion, like you said. I've watched some videos on your compassion, and that's the other thing too, right? Is now you see, you as a child, or you as, you know what I mean, and what you've gone through, and so you show some compassion for yourself. And I've had to set boundaries, and I've had to do stuff at work even to lessen my stress, because sometimes you have to, yeah, like, do you know what I mean? Like, I've had to do things at work that I normally wouldn't, but I'm like, okay, I need to lessen this a little bit. I need to change something that was going on in my work, because that's what got me here, all this pain, debilitating pain. So I had to do some things at work to try and lessen the stress, right? So I moved to a different, I'm going to be moving to a different section of the hospital. That's a lot. It's just less stress. I'm just going to say that.
Yeah,
So not as much pressure on myself, because that's who I am. So I've also learned to kind of, with the compassion, it's like, okay, sometimes you have to look after yourself and do things that are going to make who I am a little easier. Do you know what I mean? In that sense, if that makes sense, right?
it does, because when you feel compelled to do a great job, that's excitement, but that's actually the body in quite a heightened state.
Oh, for sure. No, I've
But
been
if
at a
you had a
heightened state.
yeah, but if you had a boss that really didn't see that and expected more, or you had colleagues that always let you do a bit more and they
Yep.
dropped off,
Yep.
our unconscious patterning means that, well, I'll better do it because I'll have to,
That
and then
other,
we feel a
yep.
bit trapped in our own behavior, and it's not anybody else's fault. It's never anybody's
No,
fault.
no, no,
But
that's
we
right.
sometimes have to remove ourselves from the triggers, actually, of compulsion,
That's right.
triggers of compulsion, and sometimes change the external circumstances a little bit. We're really
Yep.
changing internal ones, but sometimes you have to change the
Yes.
external just to come down a little bit. And it doesn't mean you can never go back to those environments, but it doesn't hurt to have a little rest for them if they're a big contributor.
No, that's like, I've been on high alert. Like, I've been on high alert since I was 14. Like, I was diagnosed with general anxiety disorder. I worried all the time. Like, I've worried my whole life, right? On high alert my whole life. No wonder. Yeah, right. The awareness, and bowling's the same. Bowling is a competitive. I'm very competitive. I've achieved a lot in my bowling career through, I put pressure on myself. As an athlete, a high athlete, you put a lot of pressure. So I've been at that high state for a long time, but now, and I've had to get reminded in these tournaments that I've bowled at recently, where I've maybe not done as good as I expect, right? Because I have high expectations of myself when it comes to bowling, and work as well, high expectations. But my husband's had to remind me, you know what? You're here bowling, right? Be grateful, because you weren't bowling.
Yes.
So be grateful for that. So my husband's had to kind of like, okay, you're right. So I get caught up in the bowling and in the competitiveness. And you do have to be competitive. Like, you do have to want to, if you want to be good at something, you got to be competitive, right? You got to say, I got to, do this and do this. So you just have to do it a different way. I just have to learn to know when to calm and not get so high up, right?
Yeah.
Learn to do the breathing and learn to not maybe be so hard on myself.
Yeah, it just needs some balance, doesn't it?
Right, it does. Balance is a good word. Yeah.
Oh, well,
Nonsense is a good word.
I've loved listening to that, to everything you've said.
Well, thank you.
But can I suggest something before I
Yeah,
go?
sure.
It's about
Sure.
that morning language, because you've got a lovely secondary voice for the one that says, "Shall we?" And you say, "No, we're okay, we can." Yeah.
Yep.
And let's say morning time is it's either really stiff or a little bit
Yes.
stiff, or it's you know.
Yes, it is.
There are a couple of things you might mention. See if you can change the language of it. So I'm not
Okay.
as loose as I'd like to be. I'm not as
Oh,
loose as I like to be.
okay. I
Rather
get
than
you.
not stiff, it's not quite as loose as I'd love to be.
Oh, loose. I hear you. I hear you.
So your
I hear
brain's
you.
focusing on what does loose feel like. If you
Oh,
say stiff,
oh,
whether you say a little bit stiff or really stiff, your brain will give you stiff.
oh. I hear you. I no, that's actually really good. Maybe I should mention that while I'm bowling too, because I'm bowling. Sometimes I get flare ups at bowling, and I'm holding the ball, and then it wants to walk up. So that I'm like, should I throw the ball? Because maybe I shouldn't, right? Because it's really like it is really tight. Most people wouldn't be able to throw the ball, right? Because it's so stiff. But I'm like, no, I'm okay. I can throw the ball. So when I throw it, I look like I'm, yeah, I don't look normal because I'm so stiff. But you're right though, because then I'm like, but then I'll come back and it's the language you use, right? So then you come back and you're like, oh, I was really stiff that shot, right? Do you know what I mean? But I get what you're saying. I'm using the word stiff, right?
Before and
Instead of
after. Before and after.
before and
I am
after. No,
feeling
you're right.
stiff. I'm
You're
doing it. And
right.
I was stiff, right? And now
Oh,
it's called task bracketing. So before the next time in practice, it's saying
yeah.
how loose am I feeling? I'll do the
Mm,
bowling. Oh, I feel really loose. I'm not as loose as
okay.
I'd like to be. I'm not
Okay.
loose. I'm not as loose in the morning as I'd like to be. But
B.
how loose will it feel soon?
Okay.
Loose, loose, loose.
Okay.
And you can pretty much flip that with any word, but you've already done it with
Yes.
a lot of things. But stiff tends to come up a few times in that chat.
No, you're right. You're right, because that's what I mean. But you're right. It's not as loose. But I totally get you. It makes a lot of sense. It makes a lot of sense.
So you've got a little bit more practice, but hey, so have I. We all have. It's
We
fun.
all do,
Something
right?
comes up every day. It's a little practice. It's all opportunity, isn't it?
It sure is. It sure
Um,
is. That's why I wanted to talk to you too, right? There's them little few suggestions, right? And stuff like that. So I'm so happy that you wanted to talk to me. So
yeah,
and
well,
stuff. So
I'm sure it really will be an inspiration. Like you might have watched other people, and
mhm.
it might be the first thing that someone sees that helps them recover, Colleen. How nice would
Yes,
that be? Yeah, we might never meet that person. We might never ever meet them, but one day they might tell their story to someone else. So
no, and that's why I wanted to tell it, because I'm a very I help a lot of people. I have the need to help a lot of people. So I hope this at least helps others. Like, I might even want to be a coach one day, because I was a coach in bowling. So I've been a coach for many years, not in this, but in bowling. I've coached many of people with their mental part, because I have a really strong mental game
yeah.
in bowling, because I'm very good with that. So yeah, so I might, it's kind of made me maybe want to help others as well, and stuff like that.
Well, I hope you're going to do it. I'm just going to pause this recording, but stay on the line
Sure.
for a moment. Yeah.
Yep.